Hi friends, this is a short conceptual video related to thyroid gland and the thyroid hormones. Consider a clinical condition, hypothyroidism. You would like to start the replacement therapy. There are two thyroid hormones, you are aware of that, the T3 and the T4. Which one will you prefer, T3 or T4? The answer is T4. It's always the T4 which is the preferred choice. It is given in hypothyroidism. Levothyronin or thyroxine, the trade name L-troxin, that's a preferred choice. The question is why? Why not T3 and why do we prefer T4 in hypothyroidism? Let's try to find out the answer to this question. The question will deepen, the mystery will deepen if I tell you T3 is 4 times more potent as compared to T4. T3 is more rapidly acting. The tissue penetration and cellular action is also more rapid with T3 compared to T4. Then, if that is the case, and final action in the cells is also going to be of T3 only, not T4, then why do we prefer T4 over T3? Why the gland also produces mainly T4 and not T3? Let's answer this question now. T4 is a prohormone. You know what is a prohormone? Precursor from which the final hormone is formed. So T4 is seen as a precursor, prohormone. That is, T4 will form T3 and T3 will exert the actions of the thyroid hormone. So all this is quite suitable because T3 is 4 times more potent, more rapidly absorbed, more better entry into the cells and action, rapid action, etc. So T4 will act as a prohormone and then it will convert to T3 and the T3 will act. You will be amazed to know that even in the body, normally, naturally, gland, when it produces the thyroid hormones, it produces both T4 and T3. But 90% is T4 production and only 10% T3. And then this T4, it enters the blood, goes to every cell, and after entering the cell, there is action of deiodinase enzyme. So one iodine is removed from T4, T3 is formed and that T3 will enter the nucleus. You know the receptor is intranuclear receptor. Then T3 will exert the action. So why is gland doing like that? It can form T3, final action is going to be of T3, then why is it that the gland is first producing T4, then it is sending to the cells, then cells are forming T3 and then T3 acts? The answer is that every cell, virtually every cell in the body is the target cell for the thyroid hormone. Why? Because thyroid hormone controls the BMR, the basal metabolic rate. So virtually every cell will be the target cell for the thyroid hormone. Simple. Which means what? Which means that we need a stable pool of the thyroid hormone in the body. We can't afford to have minute-to-minute fluctuations of the thyroid hormone levels in the body. Suppose we gave T3 and as it was given, it enters the first cell that it approaches and much of it is absorbed and acted, and then suddenly the levels of thyroid hormone drops in the blood. We can't afford to have that. We want a stable pool of the thyroid hormone, stable storage pool, and then a steady supply of the thyroid hormone to all the cells in a proper manner. And that is given by the T4, not by T3. That's the reason why gland also mainly produces T4 and we also give T4 as a replacement therapy. Right. Now what makes T4 more suitable? Let's look at some of the properties. First, let's see what happens naturally. This is a gland. Gland forms both T4 and T3. they come into the circulation. Now in the plasma, more than 99% of the hormones get bound to plasma proteins, and less than 1% is free hormone. Now this free hormone is going to be the hormone that acts. It will enter the cell, and if it's T4, then by the action of deiodinase enzyme, T3 will be formed and T3 will exert the action. But it is a free hormone which is exerting the action. It is this free hormone which is exerting the negative feedback on pituitary and hypothalamus, on the TSH and TRH secretions. And then the scheme is like this. Plasma protein binding is there, so hormone is bound, and then whenever required, it can release some hormone wherever the cells require this hormone. So the hormone will become free from some of the binding and then will enter the cells and will act on the cells. So this is that entire pool of the thyroid hormone which I am talking about: the gland, the plasma protein bound hormone, the free hormone, and the hormone that has entered the cell. This is the entire pool, and we are looking at a stable pool of the thyroid hormone in the body, and that is provided by the T4. Now the question is why? Okay, before answering the question, let me just add one more point. Plasma protein binding, it makes a reservoir of hormones in the plasma, temporary storage form, and whenever thyroid hormone is required, some will be dissociated from the plasma proteins and will enter the cells. And plasma protein binding also prolongs the half-life of the hormone. Yes, because when the hormones are bound to plasma proteins, then they will not get filtered at the glomerulus, they will not get excreted into the urine, so half-life will also increase. Let's look at the plasma protein binding of the two hormones. T4 is more extensively plasma protein bound compared to T3, 99.98%. T3 is also extensively bound, but less, means 99.5%. And then remaining is free hormone. So more T3 is relatively free in the plasma. It is the free hormone which will exert the actions and also the negative feedback, and T4 also will enter the cells and make T3 will act. Apart from the plasma protein binding, which is very extensive with T4, half-life T3 only 1 day, T4 7 days. So much more half-life, much longer half-life. And because of this, now consider T3 short half-life, rapid penetration into the tissues and cells, and rapid action, which means the turnover of T3 is very rapid. Daily turnover rate is almost 70% with T3. This is a little disadvantage with T3. I mean, imagine that it is formed, comes into the blood, enters the cells rapidly, and then after the action it is endocytosed and degraded. If this is very rapid, then there is a possibility of minute-to-minute fluctuations in the levels of this hormone, T3. T4, daily turnover rate is slow, 10% only. So because of all this, T4 provides a more stable extrathyroid pool of the thyroid hormone. Please understand this term, extrathyroid pool. Thyroid gland will have a lot of thyroid hormone, but apart from that, outside the thyroid gland, means in the plasma protein bound, and then the free hormone, and then the hormone inside the cells. This pool, plasma protein binding, free hormone, then intracellular action of the hormone, this pool is more stable with T4 compared to T3 because of all these properties. I just reiterate once again, more extensive plasma protein binding for T4, daily turnover rate is less, and half-life is much longer. So T4 provides a better reservoir, more stable pool of the thyroid hormones, no minute-to-minute fluctuations. we can't afford to have minute to minute fluctuations in the thyroid hormones, because every cell is going to need it all the time. So no minute to minute fluctuations when you give T4, and that's the reason why we give T4 even in the condition of hypothyroidism. We don't consider T3, we give T4, and it will give us a stable supply of thyroid hormone. Alright, so hypothyroidism, levothyroxine, T4, L-troxin, that's preferred. Is T3 considered at all? Well, in certain situations, some clinicians prefer T3 also. Not prefer, it's always combined with T4. For example, if you give T4 in a hypothyroid patient, and let's say TSH levels have got normalized. Yes, this one point is to be highlighted. T3 and T4, when they are low in hypothyroidism, by negative feedback, TSH levels rise. And some of the actions of TSH are also responsible for the symptoms of hypothyroidism. So let's say TSH levels have normalized after giving T4, and still the symptoms are persisting. In such a scenario, you add T3 to T4. I mean, give a combination of T3 and T4. So this is when you think of T3. Or in some hospital setups, in myxedema coma like situations, they give T3 and T4 combinations for some time period at least. So this is when you consider T3. But otherwise, T4 is the hormone of choice, not T3, and it is the hormone of choice for the gland also. In fact, gland and the body is treating T4 as a pro-hormone to form the final hormone, that is T3. So that's the small concept related to the thyroid gland and thyroid hormones.